Abu al-Qasim Khalaf ibn al-Abbas al-Zahrawi, known in the West as al-Buqasis, was one of the most brilliant physicians and surgeons of the Islamic Golden Age. He was born around 936 CE in the city of Al-Zahra, near Cordoba in Muslim Spain, Al-Andalus. This city, which flourished under the rule of the Umayyads, was a center of culture, learning, and science. Growing up in such an environment, Al-Zahrawi was able to dedicate his life to the study of medicine, surgery, and the healing arts. Al-Zahrawi is often called the father of modern surgery because he was the first to organize surgical practice as an independent branch of medicine, with clear principles, detailed techniques, and specially designed instruments. His reputation comes mainly from his monumental encyclopedia, Al-Tasrif Liman, Ajiza, and Al-Talif, The Method of Medicine, a 30-volume work that summarized more than 50 years of medical experience. The final volume of this encyclopedia, entirely dedicated to surgery, was revolutionary. It was the first comprehensive surgical text in history, and it became the cornerstone of surgical knowledge in both the Islamic world and medieval Europe. One of Al-Zahrawi's greatest achievements was his detailed description and illustration of more than 200 surgical instruments. These instruments included scalpels, forceps, scissors, hooks, retractors, and even instruments for dental surgery, ophthalmology, and gynecology. Many of these tools were original inventions, while others were improvements on existing designs. The inclusion of illustrations was extraordinary for the time, and it made his work clear, practical, and easy to follow for other physicians. Al-Zahrawi introduced groundbreaking techniques that were centuries ahead of Europe. He was the first to describe the use of catgut sutures, made from the intestines of animals, for stitching internal wounds. This material was naturally absorbed by the human body, making it ideal for surgery, and remarkably, catgut continued to be used in modern surgical practice until the 20th century. He also described the process of cauterization for stopping bleeding, the removal of bladder stones, the treatment of ear, nose, and throat problems, and the management of difficult childbirth, including cesarean sections and the use of forceps. In addition to surgical methods, Al-Zahrawi contributed significantly to general medicine. He gave one of the earliest and most accurate clinical descriptions of hemophilia, a genetic disorder in which blood does not clot properly, and he discussed tumors and cancers with unusual clarity for his era. He also explored the treatment of fractures and dislocations, demonstrating a deep understanding of anatomy and physiology. The influence of Al-Zahrawi spread far beyond Al-Andalus. His Al-Tasrif was translated into Latin in the 12th century by Gerard of Cremona, and it quickly became the standard reference in European universities such as Salerno, Montpellier, and later Oxford. For nearly 5 centuries, European surgeons relied on his work as the main source of surgical knowledge. Renowned European physicians such as Guy de Chauliac frequently cited Al-Zahrawi's methods in their own medical texts. In fact, in Europe, the name Abulqasis, derived from Abu al-Qasim, became synonymous with the word surgeon. What made Al-Zahrawi's legacy so remarkable was not only his technical expertise, but also his humanitarian vision of medicine. He emphasized that a physician should be compassionate, ethical, and dedicated to the well-being of patients above all else. In his writings, he warned against greed and arrogance, reminding doctors that their mission was to heal, not to seek fame or wealth. This moral dimension of his work inspired countless physicians in both the Islamic and Christian worlds. Al-Zahrawi passed away around 1013 CE in Cordoba, but his contributions changed the history of medicine forever. He combined practical knowledge, scientific innovation, and a deep sense of humanity, leaving behind an enduring legacy that bridged cultures and centuries. Today, historians of science recognize him as one of the key figures who laid the foundation of surgery as a science. His life and works stand as a shining example of how the Islamic Golden Age contributed to the progress of world civilization.